I'm Dr. Cynthia Browne. I'm a breast cancer oncologist, and I'm here today to talk to you about the First Sense Medical Thermology Scan. It's one of the newest pieces of equipment in our armamentarium of screening for breast cancer. A cancer cell is a cell that has undergone a mutation that allows it to grow out of control. Normally, when a cell is going to divide, it has to get a building permit from its neighbors. There has to be an empty lot so that there's a place for that new cell to go to. And a cancer cell either does not ask the question of its neighbors or it doesn't listen to the response, so it starts to continue to grow and there's no place for those cells to go, so it builds up into a ball, into a tumor. That is what makes a cancer cell to start with. Now, once it gets to be the size of a grain of salt, it needs more nutrients in order to keep itself going. And so it will send signals to the body that says, send me more food, and the body will respond by producing more blood vessels to bring those nutrients to the cancer cells. We call that neoangiogenesis. And that is good for the cancer, but it's not so good for us. And so just like people need food and water in order to survive, the cancer cell needs additional nutrients in order for it to survive, and it gets those nutrients by making a lot more blood vessels. When you have more blood vessels that are coming into an area, there's going to be more heat in that area. So that is really at the heart of this scan, that difference is what we are looking for. How is the cancerous area hotter? How much hotter is it than the normal cell? So this piece of equipment has a highly sensitive heat camera that can detect that difference, and it will give us a general area for where the abnormality is. Breast thermology is detecting this difference in heat between cancerous cells and normal areas. It's a very sensitive piece of equipment that can measure that change, and we can increase the difference in temperature by blowing cold air on the patient. And in a normal area, the blood vessels will constrict with that cold, and that will decrease the temperature of the breast. But a cancerous blood vessel does not constrict with this cold challenge, and so that area will stay hotter, and we can pick that difference up with this sensitive heat camera. The First Sense Medical Sentinel breast scan is the only automated thermology device on the market. It's an FDA-cleared device for adjunctive breast cancer screening, and it has proprietary software algorithms and a state-of-the-art heat camera in order to allow us to detect these differences in heat. It is very easy to use. The results are then interpreted and a report is printed out for the patient and for the physician. All women should be screened for breast cancer once they reach a certain age, and there are many different techniques out there, but this is an additional technique that can be used. It's very easy to use. It takes fewer than 5 minutes. There is no radiation, there's no compression, and there's no pain. And so it can be especially useful for women who have very dense breasts, very small breasts, which are hard to get with a mammography, women who have implants so that they're concerned about the compression, or women who are concerned about the discomfort that's normally associated with mammography. This is a very inexpensive test as well, so it can be used for women who want to be screened just earlier than usual, just for peace of mind.